mild coronavirus illness may confer month-long immunity. A study by the University Hospital in Strasbourg and the Institut Pasteur found that even patients with mild coronavirus illness could develop antibodies. These antibodies were found to leave them immunized for several weeks. The study, which has yet to be peer-reviewed, offers findings that the researchers view as encouraging, considering that much is known about immunity triggered by the novel coronavirus. Arnaud Fontanet, the head of Institut Pasteur Global Health Department, said they were aware that patients with severe coronavirus illness develop antibodies within 15 days of the onset of symptoms. Because of their new study, they now know that even patients with mild coronavirus illness develop antibodies within 15 days after the onset of infection. However, Fontanet said patients with only mild forms of the disease had rates of antibodies that are probably weaker. According to Medical Express, the researchers studied 160 coronavirus-positive hospital staff at 2 sites in Strasbourg. After using 2 types of serological tests on the 160 health workers who were all suffering from mild coronavirus illness, the researchers found that one test indicated 153 had developed antibodies within 15 days of the onset of infection, while the other test indicated 159. The health workers were then given another test that would determine if their antibodies could neutralize the coronavirus, and 98% of them did have these antibodies within 28 to 41 days of the onset of infection. On May 26, the French researchers explained that they believe the antibodies' neutralizing activity increases over time. Oliver Schwartz, the head of Institut Pasteur's Virus and Immunity Unit, said the researchers now plan on monitoring the persistence of the antibody response and the antibody's ability to neutralize the novel coronavirus over the long term. It can take 2 to 14 days for symptoms to appear after one contracts coronavirus, but the average incubation period is reportedly around 5 to 6 days. Patients with COVID-19 can experience a number of symptoms, including a dry cough, shortness of breath, fever, headache, sore throat, muscle pain, chills, and a new loss of taste or smell. A study published in the American Medical Association's JAMA Network Open Medical Journal found that the most prevalent COVID-19 symptom is fatigue.